here. Let me try turning it this way. I'm going to keep me this way. Okay, I hope I'm straight. So while I'm talking to you, I'm going to be looking at my screen because that's where my notes are. And I'm going to do my best not to move this around. Let me see. Am I looking at you guys now? Yeah, I think so. Let me try. Okay, we'll do it like that. Anyhow, okay, let me stop moving around. Hello, YouTube, and my name is Sandra Ford. I'm the Senior Compliance Officer for Trusted Senior Specialist. And what I'm going to be talking to you today about, and I do have my notes with me, but they are on a screen. So if I'm not looking directly at you and I'm looking at the computer, it's so that I can keep up and not forget. So what are we talking about? Changes to Medicare. And there have been a lot of changes. But what we know is that when a lot of people talk about are only the premium and deductible changes, but there's so many more. And that's why I'm excited to share with you some great things that came to Medicare beneficiaries that are good for you because they weren't necessarily available before. And, you know, Medicare, I don't want to say it had a bad reputation because it really doesn't. It's one of the greatest insurances that you can have when you leave a group plan. But what I am going to say is that if you're part of a sandwich generation, you know, where you're helping parents or an older family member, a grandparent with their Medicare, you may have experienced the red tape, so to say, the red tape behind Medicare. And with the changes, we see that that is going away, and that is what's so cool. So I'm going to go over a couple of quick things. I'm going to go into the deductibles and the premium changes and those things that everybody wants to know because it's your money going out. But to me, I'm more excited of the access to care. That is one of the biggest initiatives that Medicare had this year was access to care, ease of care, reducing the red tape. That's, come on. Think about it. If you had a car accident, your auto insurance, getting what you need to get done fixed on your car, what you need to get done for the healthcare side of an accident, it's red tape. If you need to get a procedure done with your own personal group health plan, it's red tape. So with Medicare reducing the red tape by giving you access to quicker decisions is phenomenal. So let me go over this again. I'm Sandra Ford, Senior Compliance Officer with Trust Senior Specialist, and I'm going to get started on these real quickly. So here's some quick changes to Medicare. And there's been quite a few that have come out, and that's why I'm excited to tell you about them because these are things we don't hear. Let me tell you, where did I hear these? Where do I get my information? I get my information. Hang on. I was told that I was doing the camera wrong. So here's my ceiling. Is that better? It's just I get confused where the camera is. All right. So some of the changes that I know that where I find it is in CMS.gov. I go to CMS.gov because that is where the information is. So with that, let me get started. Like I said, I'm going to be looking at my screen while I'm talking to you. So if I'm not looking directly at you, that's why. So I'm going to stop saying so. I just caught myself. So let me try again. Got to stop saying that. Here we go. Medicare coverage of innovative technology. Innovative technology. Why is that cool? Because innovative technology means that if you're on Medicare, you have access to the most recent technology that has been clinically proven to be effective for certain chronological diseases and for diagnoses. So before, it was a habit of Medicare because it's a federally regulated insurance. We understand that. They have to protect themselves. We understand that. But it would take a lot of time for studies and analysis and data to come into the system for years before something that they found is effective for a general population or for certain drug disease or chronic disease before it was approved and to be considered a base standard benefit to a Medicare beneficiary. Well, that has changed. And so I'm going to read this. I'm not going to be looking at you because I'm looking on my screen. I'm going to read it to you. It has issued a final rule, and as for January 1st, 2021, that the innovative technology beneficiaries have access to the latest, most advanced devices. Now, that just means that you have access to newer devices as a senior, you have access, resulting in faster access to these devices. Now, a company would have to register under what's called an MCIT. A company does have to register under MCIT, which is the Medicare Coverage Initiative technology, in order to be accepted. But You can go to cms.gov. You can look on the website, see if something has been approved for your condition or your chronic disease. And if it has, you get to request and say, I want this approved. And guess what? It can be approved same day. It can be approved same day. So you talk about cutting out the red tape. That's what it means. You have access to care same day if they have opted into this program and it has been clinically proven that it is an effective and safe device or procedure. You have access to it without all the waiting and the red tape and the long-term study of something, which is, the research in medical, let's say mysteria. There's so many things we don't know that scientists and doctors discover, and then they'll do a couple clinical trials, and then they'll do more clinical trials, but it has nothing but positive results. It's nice to know that you can get those now too and not wait. Now, this was part of the Century Cures Act. Some of you guys may remember over the summer that was one of the bills that were passed as part of the stimulus. So it's called the Century Cures Act, and that is what that was passed under. So thank you, Medicare. Let's go into another one. Let's see. It's also going to clarify providers with claims and processing. So that's going to cut that out for them. So, we got to give some benefit to the clinicians and those who have to actually do the billing. Now, artificial heart and ventricular assist devices called VADS, ventricular, artificial hearts and ventricular devices. So I'm going to read this off the screen because, again, this is another breakthrough. And I think this is fantastic because, like I've been saying, if you live in a major medical or major city with a big medical complex, all your major hospitals have a type of offset building, in most of them, that is for cardiovascular studies. And with that, a lot of, again, medical breakthroughs happen. And when this happens, then Medicare is going to give you access to that same type of care and that same type of device. So I'm going to read this straight from Medicare or CMS.gov newsroom. It says this Centers for Medicare and Medicaid Services finalizes updates to Medicare coverage policies for artificial hearts and ventricular assist devices, both which are used to treat patients with life-threatening advanced heart failure. Now remember, it was always a stent and a pacemaker. This is different. Prior to now, here's the kicker. Prior to now, Medicare covered artificial hearts under the coverage with evidence development. Again, what does evidence development mean? Time frame. A lot of time frame. People die in that time frame. Now we don't have to. We have hope. We have opportunity. We have access. The updated coverage policy CMS is announcing today, January 1st, 2021. These things were signed into action the last quarter of last year, and then on January 1st, a lot of these things become final rule. And it says that today will end the requirement for artificial hearts and instead allow for more standard coverage determination process where coverage decisions are made by local Medicare administrative contractors. So again, if they have found something that can work today, that ventricular assisted device can be approved today and placed in today, and you don't have to go through the evidence development. Now, let's go to what everybody wants to talk about. Everybody wants to talk about premiums, right? How much is your premium? So for 2021, if you're new to Medicare or you are about to begin, let me see if I can set my camera up just a little bit because I feel like I'm moving around a lot for you folks, but try not to keep it too far. Oops. Hey, I got a whole look of everything now. I have a stand coming, so this will be a lot better for all of us. Okay, let's see if this will work. Okay, so there I go with that so again, right? The Part B coverage, if you are new to Medicare, or if you're in a group plan and you're debating on getting Medicare, you want to know what the premium is going to be. Now realize this, Medicare Part B has one monthly premium, one time a month. You pay your premium and then you have your coverage. What is that? That's $148.50. So if you're in a group plan and you're trying to decide between the two, you want to look at your premium of your group plan times your pay period, because they're going to take that premium out per pay period. And if you have a spouse on there, those are things you need to consider. So $148.50 is the Part B premium. Now, once you pay your premium, you do have deductible. The deductible has to be met, and the Medicare covers 80%. You cover 20%. Now, 20% can be a lot of money, But that's why we look at secondary plans. We look at Medicare supplement plans, we look at Medicare Advantage plans. In some cases, people may stay on original Medicare and get a hospital indemnity plan. Whatever is best for you, that's what you'll discover when you talk with one of us, because we're going to show you all the options. And we're going to go through all your options and talk about what the money really looks like. And that also depends on your health. You know, your health is a big decision maker when it comes to what type of plan you're going to get when you're eligible for Medicare. Is it best to stay on your group plan with Part A only and keep your group health plan, or to move off that group plan and go on to Medicare A and B? Those are the things we discuss with you. But here we go. So your Part B premium is $148.50, and your Part B deductible is only $203. Now let me say this: when I say only, that's because the Medicare Part B premium only went up like $3.90 from last year. So that's a very small increase, where some years we saw it go up, 7%, 10%. It went up a lot. This year it didn't really go up much. But if you're on a fixed income, if you're working and you're really thinking about retiring right now and you're worried about the fixed income because maybe you still have a lot of bills, you got a debt on a car, maybe you are still having to pay rent or a mortgage, that's okay. There are programs to help pay for that Part B premium. And if that's something you're concerned about, don't be. Let us help you. We can help you apply for the programs that are state and federal programs that will help pay for those premiums, okay? So make sure you can go to our site, trustedseniourspecialist.com, and there's a calendar, and you can click it and talk with one of us. If you don't do that, you can put a comment underneath our YouTube channel, and we will respond to you. You can call us directly. Oh, I have a number. Oh, forgive me, I wrote it down. I have a number, and it's Sandra says. So let me just give me a second. I thought I had it in front of me, but I had to fill out some more paperwork. Okay, so this is a Sandra hotline. Ready? Write it down. 1-888-689-9701. Yes. Why was everybody afraid of 6? Because 689. Let me give you that number again. The Sandra hotline is 1-888-689-9701. You can call that number and just ask for any of our Medicare experts, and they're going to go through the same thing I'm going through to help you understand those programs that help pay for the Part B deductible and the Part B premium if you qualify. Now, the Part A. Well, what does Part B cover? I didn't really tell you. So if you're new to Medicare or you're not sure how Medicare works, Part B covers your doctor, your hospitals, any inpatient procedures that are done, your specialists, durable medical equipment, ambulance, some home health, infusion services, certain prescriptions done in the doctor's office, again, such as infusions, radiation, any kind of therapy like that. So any kind of procedure that is covered under Part B. So if you're admitted to the hospital, any services done, lab work, whatever, that is going to be Part B. Okay, so Part B is all medical. What is Part A? Well, Part A is you usually don't have a premium for that, because if you work 10 taxable quarters, then you've been entitled to it, and you don't pay a premium. If you don't have your 10 quarters, then talk with us and we can help you with some options until you get those. We'll have a conversation with Social Security and help you understand what that means or what's required if you haven't already done this, or if you just want some confirmation or reassurance. We're good at doing that too. Our customer service department is bar none, I promise you. One thing that we do is we do deliver what I call old-fashioned customer service with today's technology. It is, you're not going to get better customer service with our team. Now, Part A covers your inpatient hospital, skilled nursing, hospice, and again, the home health services. Now, when you pay that Part A deductible, you ready? It's $1,484. $1,484. When you pay that deductible, that gets you in the hospital. Okay, so if they do any lab work, urinalysis, they do a blood draw, MRI, surgery, all of that's billed to Part B. All the Part A deductible does is get you in the hospital. If you go in for into the hospital and you they bill Medicare under Code A, Medicare approved Code A. I'm just giving you a fictional letter here, and you are released and you go back in within 60 days and it's still for Medicare approved code A, you won't have to pay that deductible again. If you get out of the hospital and it's more than 60 days and you go back in for Medicare approved code A again, you'll pay that $14.84. So if you get out and you go back in 60 days later for the same reason, you'll pay it. Now, if it's within 60 days, you don't have to pay it. But if you go in for Medicare approved code A, again, that's a fictional code, I'm just trying to make an example, you pay the $1,484 to stay in the hospital. That covers you for the first 60 days. Now, do know this, after 60 days, that daily copay increases, goodness, until you get to 150 days and you're 100% responsible. That is why we cannot emphasize enough. Do not stay on original Medicare. Always get a secondary plan. Always. Whether it be a Medicare Advantage or a Medicare supplement, work with us. Let us help you get a secondary to protect your wealth. Now, let's say you get discharged from the hospital and you go back in for Medicare approved code B. Now, you were just in the hospital 2 weeks ago. They released you. Now you have another problem. You go back in. It's under another Medicare code. Guess what? Pull out your checkbook. You're going to pay another $1,484. So that is why it's important that you get a secondary plan, because every time you go in the hospital under a different approval code with Medicare, you're going to have that deductible. So that's what Part A is, okay? Now let's look at some of the other changes that are very positive with Medicare. Man, we've heard a lot of news of people who couldn't afford their insulin. They were making poor decisions. People were getting sick. People were dying. Well, thank goodness last year, well, I think 2 years ago, this was actually put into force and it has been approved. And so here we are, 2021. Those on insulin won't pay more than $35 a month for their coverage for insulin. $35 copay. That is awesome. But we do know that people are on fixed incomes, maybe on a limited budget, have dwindled through their savings just because, inflation or whatever. There are programs to help pay for your prescriptions. We have access to those applications. We will screen you. We'll submit those in with you through to Social Security. You'll know within less than 30 days if you have been approved, and you will be responsible only for a third of that cost. So don't think that when you hear $35 for my insulin, that sounds okay, but that $35 I need to keep my house warm, there's programs and we will help you with those. And we want to, but that's so exciting. So for everyone, you can afford your insulin and you won't get sick. Medicare has made a promise to help. I love what CMS has done in this last couple of years. End-stage renal disease. And I say a couple of years because a lot of these things were put in to the beginning phases, but it takes time for go through the voting. It takes time to go through the administration process. It takes time to get with pharmaceutical companies to come to an agreement. That's why you'll see these things. And I'll tell you one that just got approved January 10th, January 12th. We have a benefit that just got approved, but it won't be effective until January 23rd, January 1st, 2023. And then you'll understand the process and why. So that's why I say for the last couple of years, Medicare's really been pushing things, and a lot of these final rules became effective on January 1st, 2021. So you guys are really going to be able to embrace these wonderful improvements. End-stage renal disease, it's known as ESRD. If you don't have it, you wouldn't know what ESRD meant. But for people who are on Medicare and they received Medicare because they had end-stage renal disease, they were kind of locked in. They were on when you have end-stage renal disease, even if you're under 65, you would get your Medicare at the fourth dialysis, your fourth treatment. Medicare kicks in. You couldn't join a plan. You could join a Medicare supplement plan A, but the benefits in that plan are really not that great. A plan A is not, it doesn't stand up to the plan G and the plan N or some of the other plans. So a plan A doesn't cover a lot, and it's very expensive. The premiums are, $300-400 a month. So it wasn't best offering. So now that's gone away. What does that mean? That means that if you're on Medicare because you have renal disease, you can now go into any Medicare Advantage plan that's available in your area, because that question is no longer a kick-out question. And do know this, when you turn 65, if you're on Medicare now because of ESRD and you're under 65, when you turn 65, for the first 6 months from your first 65th birthday, let's say you turn 65 in February, from February, so February, March, April, May, June, July. So from February to July, that's your first 6 months of being eligible or newly eligible for Medicare. You enter a new election or enrollment period. You can choose any Medicare supplement you want. So if you are in a Medicare Plan A and you have ESRD, you have the right now to enter into another type of plan. It's not a kick-out question. When you turn 65, you will be able to have access to all the Medicare supplement plans for the first 6 months with no medical questions asked. That's always been there. You just have to turn 65 first. But the end-stage renal disease, if you have end-stage renal and you developed it after you joined a Medicare Advantage plan and you've been locked into that plan for several years, you can now change. Good change, right? I love that one. That's great because I know someone personally affected by this, and I'm excited to know that I can offer him more things. Let's talk about cancer. No one likes that subject, but it's a fact. It's a fact. Let me give you a stat. 1 in every 2 men will develop cancer. 1 in every 3 women will develop cancer. Those are some pretty heavy facts. But here's what has been happening, and this is what won't happen anymore. When it came to cancer, there's treatments, and either if you haven't been through it, somebody you know has been through it, so you know where I'm going with what you can relate to what I'm saying. Let me say that right. You can relate to what I'm saying. When you are prescribed therapeutic radiation, your doctor can say you need 15 treatments. When you go in for the night treatment, we're going to go and do a blood scan. We're going to draw blood. We're going to do another MRI. We're going to look at where we're going. We're progressing. And then you might go to a freestanding building. You may go to inpatient, whatever the case is. When this thing happens, if you're an original Medicare, you'd have a copay for each time you go. And that can really add up. Think about that. If you have, say, 13 radiation therapies and some are inpatient, or not inpatient, but within a hospital setting, outpatient in hospital setting, and 2 MRIs, that's extensive, and that's a lot of money. What Medicare has done, what CMS has done, is they said, you are going to bundle those costs. You're going to bundle them. And so if you have to get, let's say, a couple radiation therapies, and then they have to do an MRI to see where you are at that point, and then do a blood draw, that would count as 1 code, not 3 codes. That is what's awesome. So it not only reduces the cost to Medicare and even the headache to the billing nurse, right? But it also reduces the bigger cost to you guys in time. My goodness. So let me see if I can read a little bit of this off to make sense. So let me give you that stat one more time. 1 in every 2 men, 1 in every 3 women. And I always talk about Medicare because, you know, we are the Medicare experts, but Medicare does cover the treatment for cancer. There's things it doesn't cover. So if that is something you're concerned about, let me just say this. We do offer cancer plans. And so that's something that if you're on a group plan and you feel good about it and you're not going to move into Medicare right now, that's okay. We still want to talk to you because there's decisions that you need to, or things you need to be aware of, like late enrollment penalties and when is the best time to make the next step. But if you don't have a cancer plan, that's something you really should consider. There's so many benefits to that. So that's something else I just want to mention that we do have. So make sure you talk to one of our agents about that. I'm going to read this straight off the screen, okay? So the Centers for Medicare and Medicaid Services finalized a new innovative center model expected to improve the quality of care for cancer patients receiving radiotherapy to reduce Medicare expenditures through bundled payments that allow providers to focus on delivering high-quality treatments. I told you, access to care. High-quality treatments. The new radiation oncology model allows this focus on value-based care by creating simpler, more predictable payments that incentivize cost-efficient and clinically effective treatments to improve quality and outcomes. So how does this work? Well, under the current fee-for-service payment, so if you're an original Medicare, you have what's called a fee-for-service, all right? You pay every time you go. Medicare pays providers and suppliers for each individual service they perform because each service will be a code. So additionally, Medicare pays differently for radiotherapy depending on where it's received, whether it be outpatient department or freestanding therapy. The differences in payment rates can incentivize Medicare providers and suppliers to deliver radiotherapy over more visits or to deliver it in services in one setting over another. and that results in a different cost to the beneficiary. Now that they have to bundle, that's going away. It's not saying that your doctor was out to cheat you or take a lot of money, but I mean, business is business, right? Now they're going to be in the business of just working to get you better. So I told you that there was one benefit that has just been approved that won't be effective until January 1st, 2023. And the reason is because just because you have an idea and you want to get something going, it goes through the process, and then it has to get voted on, it has to get approved, it has to go through the fine tuning of it, who's going to be involved, who's not going to be involved, it's that kind of thing. But the final rule came out January, I think 10th or 12th this year. It will be effective January 1st, 2023. So it is a final rule, it's approved. So if you guys understand formularies, right, you have what's called a preferred list of drugs. You have a preferred brand. No, let me start from the bottom. You have in your generic bracket, you have preferred generic, most common, then you have generic. Then you have preferred brand, and then you have brand. So your preferred generic would be less expensive than your preferred generic would be less expensive than your generic. Your preferred brand would be less expensive than your brand. And then you had specialty. So there's 5 tiers. Preferred generic, preferred brand, specialty. Specialty is a 33% copay. So it gets very costly. But what they have found was that a lot of people take most commonly prescribed these certain specialty drugs, whether it be an infusion for lupus or maybe for HIV, for hepatitis C. They found these to be the most common specialty drugs to be prescribed that are clinically proven. Always got to put that in there. They created, and this will start again 2023, they created a preferred specialty tier, which means that those drugs that are in that specialty tier will have less cost than those in the regular specialty. So again, another way to reduce costs to Medicare beneficiaries, access to care, caring about you. I love it. I love it. So again, listen, make sure that you join all of our platforms. We have different things on all of our platforms that are beneficial, especially in our Facebook pages. We have Trusted Senior Specialists, but we also have a group, and you can opt into that group, or you have to ask and then we let you in, okay? If you go to our Facebook page, Trusted Senior Specialists, and you look for the group, Your Medicare Matters Because You Matter, join that group. There's a lot of people in there. People are talking to one another. They're giving tips and hints and experiences. If you're new to Medicare, just trying to get a grasp of what it is and how it's going to work for you and what to stay away from, that's where you're going to find it. And then, of course, we are very engaged in that group, and we want to deliver the most recent news, most exciting news, most informative tips, things that are going to get you what you need to be healthy and to preserve your wealth and just to make you better, keep you well. So join those groups. Call. Let me get my number again. Call my hotline 689. Ready? I love it. Why is number 9 afraid of 6? Because 689. Okay. 1-888-689-9701. Just call this Sandra hotline. Ask for any of our Medicare experts. They can all help you. We've been doing this for years, folks. We've got it down to a science. We understand so much of Medicare. I promise you this, you don't have to learn it all yourself. Talk to an expert. We love doing Medicare with you, and you're going to be happy. Join those Facebook pages and stay engaged. We want to help you as much as we can. And again, if you're on a fixed income, no, don't worry. There are programs. We will help you get access to those programs. I hope you all have a wonderful day. I enjoyed talking with you, and just Happy New Year. Talk to you guys soon.